It has been a war against the coronavirus globally. There is a tremendous sense of panic and fear amidst the midst of people in this world. The Prime Minister of India, Narendra Modi, has called for Janata curfew from 7 to 9 p.m. on Sunday so that we can practice what is called the social distancing. The current status of coronavirus, the number of cases as of this minute stands at 276,462 and the number of deaths is about 11,417. It is said that over 90,000 have already recovered from this virus. As far as India is concerned, there are 256 positive cases as of this minute and 4 deaths reported. Now, the biggest challenge as far as India faces is diagnosis and detection. The process is convoluted. The swabs have to be sent to the testing centers, which are very limited in number. So this company, AES Technologies of Coimbatore, has designed an artificial intelligence tool that will help expedite the diagnosis of COVID-19. So let us talk to the CEO of the company, Mr. Ramesh, and understand how this process is done. Now that the government has called for ideas related to coronavirus, related to its detection, related to its diagnosis, this company believes that this would be a very effective solution. Let us talk to him. So, Mr. Ramesh, you call this artificial intelligence technology a breakthrough. Why do you call it a breakthrough?
See, this is basically what we have done we have taken a proven methodology from Alibaba. Already they have proved it.
Okay, which is a Chinese
platform, and we have taken the data sets from Alibaba, and it's proven already.
That means you have taken the database from them.
Yes.
Okay.
The database have been taken from them.
Okay.
We have taken almost 5,000 different cases.
Okay.
It has been diagnosed there actually.
Okay.
It was proved, and the same data sets and the diagnosis information we have taken, and we are basically comparing those diagnosed reports. Along with our whatever the information we are going to get it.
So now that you say that they have already developed it,
yes.
How different are you? I mean, is there been any other improvising that you have done?
Yes, actually what we have done is the Alibaba has the database,
okay,
and we have already built image comparison solution in artificial intelligence,
okay,
and deep learning methodologies.
Okay.
So which we have deployed this particular solution in different industries, like in jewelry, and even in healthcare also we have done it. So the same technology we are replicating here for this corona pandemic situations.
Very good. Okay, so now could you explain very briefly but very clearly without jargons,
okay,
what is the process? How do you say that you can expedite diagnosis? What is the first step?
Yeah, see, currently the pandemic coronavirus, the government could not able to make it quickly diagnose this information, whatever they are receiving. But
because as of now they're taking a swab.
Yes, they're just taking the thermal detections using a small device. What we are proposing is a mass thermal detection.
Okay.
For example, you can go to airport and railway stations. You can see mass people are coming inside.
Right.
And there are only 1 or 2 people there doing the thermal detections. But what we are suggesting is we will place a massive thermal stations, cameras, so that we can get more information from them, and we can quarantine the high temperature patients,
right,
who are traveling that area,
right,
and they'll be quarantined, and immediately they will taken care of to the medical facilities.
Okay. So there, what happens after that?
So after they go into the medical facility, we are suggesting them to go for a CT scan and the X-rays immediately.
Okay.
In the sense, we cannot, the controversy is like, patients, they feel like, they are going into the X-ray and CT scan.
Because
CT scan is a radiation.
Yeah.
They feel that, it's very insecure for a fever patient.
Unsafe.
Unsafe.
Yeah.
But this situation, pandemic situation, we cannot take a chance.
Right.
Okay. At the early stage, we have to identify. So they have to go through for that. Okay. Once they go through the CT scan, immediately our solution will provide the comparison with the
already available
database, and it will prove the and we can able to find out the positive and the negative patients.
Okay, so it will compare two CT scans.
Correct.
That is the patient CT scan with the CT scan in the database.
Correct.
And will give a result as to whether the person is corona positive.
Positive, yes.
And so what exactly would you want the government to do?
Yeah, we want two things from the government.
Okay.
One is on the pandemic, high volume, mass volume of this thermal scanners needs to be done.
Okay.
And the second one is the data sets, that is the database, the affected database, the corona affected database is been there in even in India as well as in Italy and in other countries,
right.
China also.
Right.
Okay, we have to get all this information and collate in a single server, and we have to keep it as a solution. Okay. Whenever we are finding a positive corona, patients, we can, database that.
So this AI solution, according to you, expedites the process of diagnosis. For instance, as of now, they are taking a swab, sending it to the testing centers, which are very limited, and it takes a lot of time, say 4 days,
Correct.
5 days, or maybe even more, depending
Correct.
on the number of patients.
Correct.
So how do you think yours is a better solution?
See, currently the timing, it's 4 days they are taking. It's a very crucial at this hour. So we are giving the solution less than 1 minute.
In less than a minute?
Less than a minute,
Okay.
yes. And the accuracy is 90%.
Okay.
Okay, so this solution is very, very breakthrough. I mean, the current solution what we have done is a breakthrough technology. Okay, which is which can be implemented in a mass level.
Okay. Thank you so much for talking to Covai Post, Mr.
Thank you.
Ramesh.
Thank you.